According to voting polls, the number one issue in America today is healthcare. Am I going to be healthy? Are my kids going to be healthy? So what is the state of healthcare in America? Well, our infant mortality rate is 3 times higher than the average of all the other countries with similar economies. Our overall cancer rate, 5th worst in the world. Our annual healthcare costs per person are twice as high as the other developed nations. 66% of personal bankruptcies in the U.S. are tied to healthcare. That's over 500,000 U.S. families every year. Life expectancy in the U.S. is not number 1 in the world. It's not 5th, it's not 10th, it's 31st. And the difference between us and the top of that list is 4 years. Think about how much life you can experience in 4 years. Imagine what it would have meant to have had 4 more years with someone that you had lost. The overall healthcare system performance of the United States currently ranks dead last among developed nations in the world. Lots of reasons for these problems, but dig deeper and you almost always find one thing in common. What does it come down to? No margin, no mission. Operating margins in the U.S. declined by 39% between 2015 and 2017. So you go from razor thin to nearly non-existent. Do we accept that our doctors need to fight to get paid? Where is the change going to come from? Washington? Well, regardless of where you stand on it, the Affordable Care Act was the most sweeping healthcare change in a generation, and yet we didn't see an improvement on any of the major indices of American health. Should we expect doctors to fix it? Well, I for one think our doctors are better off focusing on our health. Should we expect insurance companies to fix it? They answer to their shareholders. If we want a better health system, we need to be the difference. We are finding and fixing the problems that are dragging American healthcare to the bottom of the list. $21 million in annualized lift for the 3-hospital system. $126 million in annualized lift for a 7-hospital system. A $440 million lift in net patient revenue, 34 months for a 21-hospital system. This is what our difference looks like. The denials we overturn, the charges that we capture, the underpayments that we recover make dollars available for providers to invest in the quality of care. New imaging machines, precision surgical robots, new medicines, more beds, more training, more wheelchairs. The work that we do offloads the burden of coding, charge capture, denials management, underpayment recovery, and 50,000 annual payer updates so that providers can focus on care. We are here because we deeply understand the problems that are bleeding our health system of resources, and we know how to fix them. We are here because we would rather prevent the denial upstream than collect a commission for overturning one downstream. That's not a job. That's a partnership with American healthcare. So this is what, your 4th day here at Ensemble? More than a job, more than a career, when you go home and your friends and family ask you about what you do. Remember, coder, biller, collector, patient access rep, these are roles. Healthcare financial management is an industry. Revenue cycle is a sector, but redefining the possible in healthcare is what you do. Welcome to Ensemble.